past District 6990, South Florida, the Florida Keys, and Grand Bahama Island, in other words, paradise. And she's the past president of the Rotary Club of Key Biscayne and has been involved with malaria elimination and eradication for over 20 years. Ellen is a member of the Paul Harris Society and a major donor to the Rotary Foundation, a great lady, one of my favorite past district governors. Please give a warm welcome to Ellen Blasi.
Thank you, Peter. All right, I'm up. Thank you, Peter. You're giving me about 10 minutes to brief you all on something that I could speak about until you try to avoid me. So I'll do my best. I'm joined today. I invited some folks to join me today that worked with the 2020 Program of Scale Award for Malaria-Free Zambia. Adriana Lanting is from the Rotary Club of Long Beach. She is chair of Malaria Partners International. And Jim Moore from the Rotary Club of Seattle. He's a founding member and current board member of Malaria Partners International. And they can offer specific questions that you might have about the Program of Scale Award. So I'm just going to do a brief interview about malaria, Rotarians Against Malaria Global, the Rotary Action Group, which is ram-global.org. And RAM Global is the umbrella organization within Rotary International for all the Rotarians around the world working to eliminate malaria. We provide governance with Rotary International and the Rotary Foundation. We help members plan projects or join existing projects. We provide education and information from our members and our partner organizations. And we support members with grant applications on how to do them, partnering them up with other Rotary clubs and other partners. We also help with district grants. We have a small grants program that we use when someone has a project that they need funds for quickly. So we encourage the small grants and particularly district grants to be used as a pilot project, so that we can work with those to scale them up to be a global grant and possibly a program of scale, which we have now. Our little small grants program, we call it Global Grant Light. It's set up so that the grant application, the folks are going through, the Rotarians and Rotaractors are going through the process of if they were doing a global grant. Typically the smaller grants that we do and our district grants will be used to, the Rotarians and Rotaractors are actually doing most of the work with these grants. We will go into the international partners and the host countries. It'll typically include us going in and conducting education on malaria, what causes it, how to prevent it, standing water, trash around the place, that sort of thing. Then we'll also train them on insecticide-treated bed nets and how to use them, and we distribute those. Sometimes we'll do interior residual spraying. We will look to give medical care or refer medical care, not give it, for anyone that looks like they need it. And then we collect all the data. We've stabilized and kind of have a program of how we collect the data. We've learned a lot from the Polio Plus campaign. And if you would show that first slide, please. So this is, okay. No, we don't have it. That's okay. It basically just shows how we, the way we do these projects, and it's a proven way. We have Rotarians working all over the world in areas that are endemic to malaria, South America, Asia Pacific Islands, and of course, Africa. The majority of the malaria in the world is in Africa. We have programs in many of the African countries. And in fact, the program of Scale 2020 was awarded to a program in Africa for Malaria-Free Zambia. It aims to reduce the incidence of malaria by 90% in 10 targeted districts in 2 provinces, reaching 1.3 million people. It will advance the nationwide strategy championed by the Zambian National Malaria Elimination Center. This program will train, equip, and support 2,500 new community health workers to deliver integrated community case management. By providing the training, medicine, and supplies that are needed for effective malaria diagnosis, treatment, and data reporting. The program seeks to strengthen the health system's ability to respond to malaria cases and prevent transmission. Malaria is the leading cause of illness and death in Zambia. It is disproportionately affects people in impoverished rural areas. Children under the age of 5 and pregnant women are particularly vulnerable. Partners for a Malaria-Free Zambia expands on the work that's already been done by Malaria Control and Elimination Partnership in Africa between 2014 and 2019, in which community health workers played a critical role in reducing malaria in Zambia's southern province. The strategy seeks to save and improve lives by reducing malaria infection and mortality, and eventually achieving zero transmission. To implement this program, the Rotary Club of Federal Way in Washington, D.C. and Washington, USA, is partnering with World Vision, Malaria Partners International, Malaria Partners Zambia, PATH, Malaria Control and Elimination Partnership in Africa, the Zambian government's National Malaria Elimination Center, provincial health leaders, and Zambian Rotarians. The Rotary Foundation, World Vision US, and the Bill and Melinda Gates Foundation each gave $2 million for this effort, for a total funding of $6 million. Okay, a program of scale obviously is a much greater undertaking than a district or global grant, and it relies heavily on trained community health workers. So do we have, okay, so this is the getting to zero slide, and this is a proven method of us taking malaria to zero. And the Rotaractors and Rotarians in West Timor are very, very close to zero malaria in that area. And now we go down to the larger projects for sustained reduction. Jeremy, can you put up the next slide, please? Or whoever's doing it. Thank you. Okay, so who are community health workers? The volunteers are partly paid or fully paid. They're recruited from the home villages by the Department of Health and their village leaders. They're about 50-50 male to female. This is in the Copperbelt province of Africa that we've done. Mid-40s is the average age. Their average education is about 9 years. They're mostly farmers, and some have side businesses. They spend 10 to 20 hours a week diagnosing, treating, and reporting malaria, diarrhea, and respiratory illnesses. And then they refer the severe cases to the nearest health center after they stabilize them. And if you could do the next slide, please. So here are some of the community health workers outfitted, ready to go. They've been trained. They've got their bicycles, they've got their equipment, they're ready to go out into the country and meet with the people there. And if you could do the next slide, please. So this is the training that they go through and how they're deployed. They are trained by the Ministry of Health, provincial governments, district health staff, other NGOs. Sometimes we work through church facilities that are there. Then they have 5 to 6 days of intensive training, as you see, a day in the field, and then they're posted for 5 to 6 weeks at a health center very close to their village. Then they go into, they have monthly meetings where they report on what they've done. They get an actual performance review, and they get a refresher training after 2 years. Which includes new skills. We're looking to retrain some of the Polio Plus workers to come into the malaria community health work. The cost of training a community health worker is $1,000. We have a program at Rotarians Against Malaria Global where you can support a community health worker for $1,000, and that will train them and outfit them and send them into the field, which is a great thing. So if you would go to the next slide. So how can you help? You can join us. Oh, sorry, I'm not there yet. Oh, sorry, I skipped ahead, pardon me. So Rotarians and Rotaractors, obviously, in a program of scale, are doing different jobs. They plan and schedule and participate in the training sessions. They procure the training venues. And as you can see, the different things in the list here, we provide the equipment, the training, we provide a smartphone so that they can go out into the field. And then we serve as the paymaster to the community health workers. We control all the funding, giving them their allowance and their transportation. We do all the accounting for the expenses and all the training sessions, and the community engagements, and then we do the progress and final reporting on the grant. So next is how can you help? Well, you can join us. You can serve as an ambassador of RAM Global to educate clubs and districts about malaria elimination. You can start or join a malaria elimination district or global grant, and we will help you do that. You can support a community health worker with a donation from your club or district for $1,000. 67% of deaths from malaria are in children under the age of 5. It's estimated that a child dies from malaria every 2 minutes. So when this meeting ends today, 120 children will have died. And this is a preventable disease. This is someone's child, someone's grandchild. So we ask that you join us and help us eliminate this disease. Thank you. And if there are any questions, I have 2 experts on with us here today that will be happy to answer them.
Great presentation, Ellen. Thank you very much. Maybe
Thank you.
1 or 2 questions. We don't have a lot of time.
Yes.
Any specific question? I can't see everybody on the call, so please just.
Peter.
Yes, Bob.
I was going to ask, have the malaria rates dropped in these areas?
Yes, substantially. I didn't bring that detailed information with me, but the program that we use works extremely well with as you know, you probably read the WHO announcement about vaccines. You know, malaria is a parasitic disease. So it's different than the vaccine has to obviously be a little different. There's a lot of things that they're doing to combat the mosquito part of it. But yeah, the program that we have with distributing these insecticide treated nets, some residual spraying, training these folks on how to use it and all that, we've reduced in some of the mining villages in Venezuela by more than 80% in a very short time period. It's all about the training and having them realize what they need to do to prevent, because the mosquito only bites at dusk and dawn. So that helps a lot. Did that answer your question? Thank you.
Ellen, can I suggest that you put your email address in the chat so that anybody who has follow-up questions can contact you after the meeting? That was great, very informative. Thank you very much. And now let me pass over to my good friend and colleague, Director-elect Jeremy.
Thank you, Peter. I have no problem being district anything. I love it. So it's my great pleasure now to introduce Pat Merriweather Argus, who's a member of the Rotary Club of Naperville, Illinois, in District 6450. I'm honored also to say that she's my co-Rotary International Director-elect and currently serves on the RI COVID Task Force, as well as the WASH Rotary Action Group Board. She's chair of the Health Outcomes and Patient Safety Committee of the International Rotary Fellowship of Healthcare Professionals and the Council of Legislation representative. Pat has been on the ground on Rotary projects and global grants in over a dozen countries and has participated in national polio immunization days in India and Nigeria. She is the executive director of Project Patient Care, a not-for-profit that brings the voice of patients, residents, families, and caregivers to health policy and provider developments. She has over 30 years experience in improving health quality and safety through work with healthcare providers, government agencies, and legislators. She's found time during the process to be married to a Rotarian, George Argus. They have 4 sons, 3 daughters-in-law, and 7 grandchildren. And here is today to provide us with an update on the very important work of Rotary's COVID-19 task force. Over to you, Pat.
Thank you, Jeremy, and thank you. And Doug, if I could have the slides brought up. Thank you. And for those of you that have are not that familiar, the COVID task force was formed probably about a year ago. And with the COVID task force, I don't know if I can control the slides now, or I think you still do, Jeremy. But if you could maybe make it big from the beginning. Thank you.
Doug is doing this, Pat, but over to you.
Oh, okay. So with the COVID task force, you'll see on the next slide that we have representatives from throughout the world. And a part of that was to get the perspective of what was going on within the world, and also to give, again, enough information so that we could be making good decisions. And you'll see on the next slide that we are very focused on clubs and district efforts to promote the vaccination and also the risks of the pandemic. We're interested in working on with international partners, and we're in the process of structuring an agreement with Gavi that we would be providing education, not we as Rotary directors, but as Rotarians in different countries would be providing education on the effectiveness of the vaccine. And we also work on advising TRF on travel situations, the Rotary Foundation, especially in light of the pandemic. And in the chat, I've already put in for the United States the presidential proclamation that came out last week in terms of travel arrangements and ability to get people into the United States from different countries. On the next slide, we came up with 5 key areas that we're focused on. Community education is critical. And sometimes it's taking small groups, sometimes it's individual conversations, but trying to get people to understand the importance of vaccination and any public health requirements or suggestions, such as wearing masks, social distancing. We also are focused on equitable distribution, and this has become a major issue that is being addressed. But it's where we have countries, such as in the United States, compared where we have vaccinations, immunizations, medications, compared to other countries where they're struggling just to get vaccines. And some countries you'll find have still less than 2% of their population vaccinated. There's a great deal of misinformation that exists, and the World Health Organization has a website that deals with the misinformation that is coming out. And I'd say there's about 40 different messages going around the world. And one of them includes the 5G phone, so that if you have a phone with 5G capability, that it's capable of giving you COVID. So again, many examples of misinformation. And we're out there to also promote stopping the spread of COVID. We know that mask wearing does prohibit some of the spread of the COVID, social distancing, as well as proper hygiene. And certainly if people have personal protective equipment, that it's still in great need in many countries. And then we want to encourage everyone that, again, with the vaccines that are now available, to take advantage of the vaccines, because they really do prevent hospitalization and death, and in many instances do prevent the infection as well. On the next slide, I'm going to go through just to give you a sense of where geographically some of the numbers are. And just to give a sense, we did hit 5 million deaths due to COVID worldwide. That's a huge number. And we know that, you know, think about it, 250 million people have been affected by the COVID infection, as well as the World Health Organization now is predicting that we'll be dealing with this into late 2022. And that's because, again, vaccines are not getting to all countries, and we need to make sure that, you know, all countries have access to vaccines. All people that want to get the vaccine have access to them. And so the supply remains a concern, although I do know that I was on a call with COVAX last week, and they are addressing, and the manufacturers are addressing the supply issues. So I think in 2022, we're going to see some major changes in terms of getting vaccines to all countries. And the variants, until we get rid of the infection or control the infection till it's endemic, we're going to continue to see variants occur. On the next slide, this is where we get into some of the looking at the numbers. And this is as of yesterday. You can see that at one point, you look maybe 6 weeks ago, and the map was almost flip-flopped around, where there were very few infections in the western side and the northern side of the United States. And now it is now where most of the infections are occurring. And so the east and southern part of the United States have less cases now than they did before. That's a surge. A surge looks for the vulnerable populations that they can infect, and when they can't infect, they just move towards the next group of areas. On the next slide, you'll see that when we talk about why it's important, yes, young people may get infected, they may not be die, but they do get hospitalized. People get hospitalized, and the numbers still are that curve where the younger population, and when I say younger, it's, you know, under 40 or under 50, they do have the most infections, but the deaths are mostly still among the elderly population, those that, and now they've considered elderly 60 and above, but certainly when you get to 75 and 80 and you get COVID, those are, that risk factor is enormous. The challenge for hospitalizations is that we just don't have enough room in hospitals. Staff are exhausted, and it's sometimes hard to find a place for a patient to go if they have COVID. On the next slide, you'll see that the deaths, where the deaths are, the circles, the larger the circle, the more intense the coloring is where the deaths are most prominent. On the next slide, this is giving you a little bit of a worldwide view of the hotspots. The United States is one of the hotspots because, again, of our infections on, as we talked about, the western side of the United States. And you have pockets there, Russia and Botswana. And the reason this is important to look at it in terms of cases per population, what we call rates, is because an area like Botswana may not show up on the volume when you look at a map with just volume, but when it shows up here, it's because there is a rate and there is an intensity that's going on within their country. On the next slide is also the vaccination. And you can see here where the vaccinations are being given. And just to give you a sense, I pulled up these numbers this morning. In the United States, the population that experienced polio during the 1950s and 60s, they're at 85% fully vaccinated. So 65 and older are 85% vaccinated in the United States. And it decreases to 58% for those that are 12 years old and older. And now when you go to other countries, well, worldwide, 40% of the population is fully vaccinated. The United Arab Emirates, they're at 89%, Portugal, 86%, Malta, Singapore in the high 80s. And then you go down to our neighbors in Canada, and they're at 75%. And remember, I said we're at 58%. So again, we know we can do better in the United States. We know, the number of hospitalizations, the deaths can be curtailed if we get people vaccinated. On the next slide, this gives you an idea of the vaccines that the World Health Organization has approved. There's 7 of them. And the reason this is important is because when the United States on November 8th opens up our doors to those people that are vaccinated, not by country, but by those that are vaccinated, they will accept either the US approved vaccines or the World Health Organization vaccines. And you can also see here, countries have the ability, they have to approve a vaccine coming in. So you can see where the different vaccines are approved. On the next slide, this is tomorrow, the final decision on children ages 5 to 11 in the United States for the authorization of the Pfizer vaccine will occur. Most areas of the United States are already gearing up for it, pediatric offices, family physicians. There's going to be mass vaccination sites. Again, everyone's getting ready so that the children can end up staying in school. And then for the booster shots, right now it's still for those that are 65 and older, because again, that's the high risk for death. It's a higher risk for death and hospitalization. Those that work in healthcare or in high risk settings, as well as there's a discussion right now to offer it to persons 40 and older. So again, I think we're seeing a lot of a spread of the vaccines in different areas of the United States and different types for age populations. But again, this also means that as we get more vaccines in the United States, it right now is slowing down the ability to get it to other countries as well. On the next slide, you'll see that this is the slide I talked about, and we won't go through it, but you can see all the different misinformations that are out there in terms of how you can get COVID. On the next slide, just to let you know, and I think you realize this, that all of our efforts on COVID affect other things. We know that hospitalizations for elective as well as serious conditions have been denied, or there's no place, there's no room at the hospital. Vaccines for children, because they weren't in school, also are lagging behind. And this is in the United States. The economy, getting people back to work in different types of industries is a challenge. We know the pileup of the cargo shipments because of the confusion over, who can access, who can come into the country, things like that are affecting the economy. It goes on and on. So the society impact of COVID-19 is not just on an infection, it's really affecting our society, but it's affecting every society. Every country has been adversely affected by the COVID-19. And I can tell you that a study came out last week in Health Affairs that in Nigeria, where they had made real progress on reducing stillborns and newborn deaths, that has actually started to reverse itself already. So again, many improvements we made have been backtracked, and we're going to have to really do some restarts going forward. And with that, I'll turn it over to Peter Kyle.
Jeremy, even. Thank you so much.
Jeremy.
Pat. Yeah, that's fine. Very, very relevant update. If you could also put your email address in the chat box and people can send direct questions. We have one question and time for one question here from Nico Agnelli. Where can we find COVID-19 guidance and protocols for a Rotary International President visit, an in-person visit to districts within the United States? Great question.
Okay, and that will be in the White House presidential guidance, and I'll put that back up here because, again, as long as you're vaccinated and you can get a visa into the United States, you can come in. And but if you're not vaccinated, it's going to be hard to get in.
Right, but nothing internally within Rotary in terms of those protocols, how we treat the president, and from our perspective.
No, actually what they seem to do is follow, certainly you wouldn't want somebody going to a red spot right now because, again, there can be a breakthrough cases, but those that are, a free and clear and travel's welcome, they'd be rolling out the red carpet to have them there.
As we will. Thanks very much indeed, Pat, once again. Peter, over to you.
Great. Well, let me thank you, Pat, as well. Terrific presentation. And we're so fortunate to have someone with your skill and background and expertise on the COVID-19 task force. So thank you for your service. And now our final speaker, another old friend of mine, Marty Hellman. Many of you will know Marty. She served as the chair of the Rotary Foundation's Peace Major Gifts Initiative in 2021, culminating 6 years of service on that committee. She is currently a member of the Middle East North Africa Rotary Peace Center Site Selection Committee. You'll hear more about that in a moment. She served as an international training leader at the 2018-2019 International Assemblies and as training leader support in 2021. And for the past 2 years, she has been the general trainer for zones 28 and 32. Marty is also the president of the Otto and Fran Walter Foundation, a small family foundation that recently made history by inking an agreement to fully fund a new Rotary Peace Center. Listen to this, a new Rotary Peace Center in the Middle East North Africa region. The gift is valued at $15.5 million. Marty, welcome. Over to you.
Thank you very much. Thank you very much, Peter. And it's great to be here and see so many tenured friends. Yes, so with that introduction, the question, of course, is always, who the heck are Otto and Fran Walter? So I'd like to start by introducing you to them. Otto was born in Munich, Germany in 1907 with plans to follow his father into a career in the law. And he went to law school and entered the bar only to be disbarred by the Nazi hate laws when the rules came in that Jews could not have a profession. Otto, for various reasons, saw the handwriting on the wall fairly rapidly, and he and his parents emigrated to the United States. They landed in New York City in 1936. Otto was fully educated. He had 4 languages, none of which were English. Of course, it was the middle of the Great Depression, 25% unemployment. There was a lack of interest in hiring immigrants and certainly not in hiring Jews, but he worked hard, he got ahead. And by the 1950s, he was established enough that he could go back to law school a second time in the United States and enter the law and enter the bar in the United States, which he did. He started his own law firm. And by the 80s, 3 things happened in the early 80s. One was that he joined the New York City Rotary Club. The second is that he started the Otto and Fran Walter Foundation more or less as a rich man's philanthropic pocketbook. And the third was that the firm hired my husband, Frank Hellman, as a newly minted law associate. At some point, it became clear that Otto was grooming my husband, Frank, to take over the foundation, the Otto and Fran Walter Foundation, on the death of Otto and his wife, Fran. And that indeed happened in 2003. So in 2003, Frank and I, who'd spent the first half of our careers trying to make money for our respective bosses, turned over to learning how to spend money philanthropically. And from the beginning, we invested money into the Rotary Peace Centers because of the connections, the Rotary connections, and because Otto's overwhelming desire was peace, in specific peace between his native Germany and his adopted United States, but peace throughout the world. Now, you may have seen a version of this map that shows where the peace centers currently are. The ones in gold are the ones where a master's degree is offered, including Duke University, North Carolina in Chapel Hill, which some of you may have been to be very familiar with. The master's degree program tends to get all the press, or I shouldn't say all, but a lot of the press, as well it should, because it's an amazing program, and it's an amazing fellowship. It's $75,000 a year times 2 years to get that master's. Less talked about is the Professional Development Certificate Program, and that's what we'll be talking about from now to the end of my short presentation. And from the beginning of the program, there was one professional development certificate school, and that was at Chulalongkorn University in Bangkok. But about 4 or 5 years ago, the trustees organized a blue ribbon panel to look at the peace centers and say, what are we doing well? What can we do? What can we do better? And although there were changes made to the master's degree program, the professional certificate program was changed substantially. The blue ribbon panel pointed out to the trustees that Rotary got bigger bang for its buck out of the professional certificate program. For one thing, it's a much shorter time on campus, so tuition is a lot less, and also a shorter return on investment, because the certificate program tends to attract mid-careerists, slightly older people who are already working in the areas having to do with peace. And so the payback is less. And so about 5 years ago, about 4 years ago, the trustees embarked on an expansion program of the Professional Development Certificate Program. And when fully enacted, the expansion program will see a total of 4 of these schools. The new ones to be in Sub-Saharan Africa, Latin America, and Middle East, North Africa, all places where peace is needed most. And at that point, the school in Chulalongkorn will transition over to an Asia-specific program, because all of these were to be designed to be regional programs. Now, and in fact, the first one at Makerere has started, and despite or because of the pandemic, and is actively moving forward. Now, as I said, these are all to be regional programs. And to be honest, I didn't pay much attention to that distinction. If I was thinking anything about it, I was thinking that Rotary was getting smart and was going to pay less money to United Airlines to get people to Thailand, and more money to get people around the world. But that, I realized how wrong I was, and how significant this change was. About a year and a half ago, I was on a Zoom call with Yinka Babalola. At that time, he was finishing up his term as Rotary International Vice President. And he said, Makerere marks the first time in history that an institution in Africa has been designed to train Africans to find African solutions to African problems. And that just blew me away. That was so significant. It's so post-colonial and so necessary in this world. And it got me to thinking about my other job with the Otto and Fran Walter Foundation, and what Otto's legacy really ought to be. And I started talking to people, well, starting with the board, of course, of the Walter Foundation, but I spoke to a lot of Rotarians. Peter is among the people that I spoke with. And of course, it culminated last February with the announcement of a new peace center to open in the Middle East, North Africa region. Now, 3 things I didn't know last February when this announcement came out, or at least I hadn't thought about, and I'm glad I didn't, because I wouldn't have had the nerve. One is that it's the second largest gift to the Rotary Foundation. It's a way second after Bill and Melinda Gates, a matter of decimal points, but even so, it is the second largest gift, and it's the largest gift to not have any financial contributions on the part of Rotarians tied to it. It's also the first time that the trustees have agreed to name a program after the donor. There's plenty of things named after Paul Harris and Arch Clump and so forth, but not after the donor. It's not the Bill Gates polio immunization program, for example. And so this really is has changed the way that Rotary and the foundation think about giving, not only in Evanston but also in our donor population. And I've been hearing a lot of good talk about that, and how it used to be that if you wanted to name something after your family, you could go to your university or maybe a hospital or maybe a cultural organization. Now you can go to Rotary as well. So this is all very good. Now, where is it going to be? That's a $64,000 question. I guess it's the $15.5 million question. I don't know, and I'm on the committee, but I can tell you what the parameters are. The parameters are, of course, we'll partner with a university which has expertise in areas of peace and development. Just as all the other peace centers are partnered with universities with existing expertise. It will be in a Rotary country, and those countries are shown there in red. And it will be located in a country that has visa requirements and so forth that welcome all international students, no matter who they are, no matter what their ethnic background is, no matter how they worship. And as you can imagine, once we're talking about this area, that's fairly limiting, but not overly limiting. And I can tell you that the selection committee is on track to name semifinalists by the end of this calendar year. And if COVID allows us to travel and make site selections, we hope to have a potential partner in front of the trustees for their consideration before the end of this Rotary year. And so with that, I will turn it back to you, Peter.
Great, thanks, Marty. What a terrific presentation. What exciting news that in this Rotary year, we may have another peace center somewhere in the Middle East, North Africa. Thank you, Marty, for the gift from the Otto and Frank Foundation. That was a tremendous gift. We've come to the end of 3 very good presentations. Thank you, Ellen. Thank you, Pat. Thank you, Marty. This has been a terrific seminar workshop. I thank all of you for your contributions. We never have enough time to get to dig as deeply into these topics as we might, but please feel free to get in touch directly with Ellen or Pat or Marty. They're all very responsive. They're all very enthusiastic and passionate about their subjects, and they will be delighted to give you an extended address should you so desire. So with that, I thank you all for participating. Our next Zoomformation call will be on December the 6th. The focus will be on disease prevention and treatment. Please make a note, December 6th, to come back and join us for what I hope will be another stimulating and exciting presentation. Thank you all. Have a great day, a great week.